Good Tuesday afternoon. I'm Dr. Martha Buchanan, Senior Director and Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to our team and volunteers who worked this weekend's vaccination clinics. We vaccinated 2,000 people during pre-scheduled appointments on Friday and Saturday. The vast majority of these folks were over 75. With the remainder in the other priority groups. We are thrilled that we could provide this much needed and wanted protection to those who signed up. We heard some great feedback from folks who were overjoyed to receive the vaccine and were so appreciative of this opportunity. It's those moments that make all of this worth it. And our staff is really thrilled to be able to start vaccinating and offering people some hope. We know there are many more folks who want this vaccine and have not yet received it. And we know that you are frustrated, and we are too. But please hear me now. We are working as hard as we can to get these additional doses and create opportunities for you to get vaccinated. But once again, this all depends on a variety of factors, such as staffing, location, and supply. Right now, the demand continues to greatly outpace the supply, and will for the foreseeable future. A perfect example of this happened on Friday. We announced 1,000 appointments for Saturday. These appointments filled up in a matter of minutes. We were pretty amazed. That's because we had tens of thousands of people calling our public information line and more than 4,000 people waiting on our website for the appointments to open up. As you saw on Friday, when that's the case, 1,000 appointments will go quickly. While we were thrilled by the interest in this vaccine, there simply isn't enough of it right now, and we can't make appointments for vaccines that we don't have. We continue to work with the county IT to roll out a new online registration system that will have a waitlist option. Our team has worked incredibly hard and has done a lot of research to find a system that is robust enough to handle the expected volume, while also having features that can be used internally by our clinical team to increase efficiency of appointments. We are working through the contractual process to begin utilizing the system and hope to have an update later this week. For our vaccination update, we continue to vaccinate those in the first priority groups, including healthcare workers, first responders, and those 75 and older. For a full list of the qualifying groups, head over to our vaccine information page. On this page, we have listed each priority group as defined by the state. Our hospitals are also operating off of these priority phases with their vaccination opportunities. As a reminder, KCHD and hospitals are the primary vaccination hubs right now. Long-term care facilities are being vaccinated through a federal partnership with select pharmacies. We continue to look forward to when the vaccine supply is greater, which will allow more places to administer the vaccine. It's important to remember that right now, we are in the initial vaccination phase. There will be transitions. Public health is just one part of the larger system, which includes medical providers, hospitals, and pharmacies that routinely provide vaccine, and we anticipate they will also be providing COVID vaccine in the future. In the coming weeks and months, we will transition to those groups stepping into their vaccination role. This will help speed up the process and increase access to larger groups of individuals. So more access points, more people get vaccinated, but we have to have the vaccine to have those access points. For those who've recently been vaccinated with their first dose through KCHD, you have been given a card that tells you a date you will receive your second dose. Because of the logistics involved in coordinating these second dose clinics and first dose clinics, you must be available on that date. We do not have the luxury of unlimited space, staffing, and resources to accommodate everyone needing to reschedule their second dose appointments based on their convenience. The date you receive is the date you must be available to receive your second dose. Please plan ahead when you're getting your first dose to make sure you're available 21 or 28 days later to receive your second dose, depending on which vaccine you receive. We want to briefly provide a testing update before we go on to the local situation. As you've seen on our benchmarks, testing has decreased a bit in our community. That's a trend that we are seeing here at KCHD as well. We are no longer seeing the volume of folks coming to get tested that we were seeing before the holidays. On average, we are currently seeing less than 200 people a day come get tested. A few weeks ago, that number was over 400 a day. This is consistent with what we've seen across the community and across the country. We are hopeful that this is an indicator of a lower burden of disease in our community, but we will continue to keep a close eye on it. We continue to urge anyone who has symptoms or has been exposed to COVID, please get tested. And now I'll move on to the local situation. We have 109 new confirmed cases since yesterday's report, 3,079 active cases. 100 Knox County residents are currently hospitalized. This number continues to trend in the right direction. This is very encouraging and something we will continue to monitor. Everyone needs to continue the practice of 5 core actions, regardless of whether or not you've been vaccinated. And sadly, we have 2 additional deaths to report today, raising our total to 446. And now I'll open it up for questions.
All right, first question we have is from David with WVLT. With the very large call volume for the vaccine clinic last week, what changes is the health department looking at?
As I said, we're looking at a system that will allow for scheduling appointment and wait list. We've also increased our phone answering capacity and adding staff and partnering with community partners to expand our call center as well.
He also asks, were there any issues with passwords for people trying to register?
There were no passwords required that I'm aware of. So no.
Another question from David with WVLT. The White House expected to tell governors they will get more coronavirus vaccine doses starting next week. Has KCHD been told to expect more vaccines soon?
We have calls with the state of Tennessee twice a week. And they continue to tell us we might get more vaccine, but they don't know for sure, and they don't know how much that'll be. So we will wait to hear from our state partners.
From Cole with WBIR, when you found out just how many people called to get appointments on Friday, what did you think?
Well, I was happily surprised. The interest and the desire to get this vaccine is encouraging, especially among those most vulnerable, and we certainly want to make sure they get it. But it was surprising, the volume. And so we will continue to put vaccine out and make it available, make opportunities available for people to get vaccinated throughout the community. And hospitals are doing some vaccinating. We're doing some vaccinating. And as we said, soon, hopefully be coming to a pharmacy near you.
From Elizabeth, I believe with WATE, what is your reaction and response to County Commission's decision last night to postpone for 90 days the vote on whether to strip the Board of Health of its power and make it an advisory body?
I think it's an opportunity for us to refocus and for them to refocus on the things that we need to be focusing on. For us to be able to spend less energy worrying about that, and more energy focusing on getting people vaccinated, and the Board of Health to focus on their job, which is to make recommendations for mitigation. And honestly, for County Commission to focus on some other things that they could focus on, such as recovery, economic recovery, and other types of recovery that we need to be working on in our community.
From Jeff with WATE, how many call takers do you have, and how many calls can you realistically handle?
We'll get back to you, Jeff. Somebody's got to tell me what that number is, because I don't know it off the top of my head. Oh, she's going to write it up there now.
I could just say we have 10 right now that we have that are able to take calls from our public information line, but we are adding 4 more this week.
And how many calls? I don't. Yeah, we'll have to get back to you on the how many calls we can take.
And just as a note on that too, it's going to vary with calls too, just because there's a variety of information that folks are calling our public information line for. And so sometimes those calls are really in-depth questions about quarantine and isolation guidelines. Some of those are yes/no questions about vaccination appointments. So that just can vary.
And This is Charity Benefi jumping in from the background. I think the other piece on that is we've expanded capacity because we are routing some of those calls to other people as well. So that's another way to expand capacity in the phone bank. So isolation and quarantine calls are actually getting switched to another group of people to answer those to free backup space on the phone bank.
Right. Sorry, that was a lot of answers there, Jeff. So hopefully you were able to hear all of that. From Cole with WBIR, can you give us some description of what it was like in your call center on Friday? Such as, do the folks there all work in the same room? Were the phones literally ringing off the hook? And how many people worked to answer the calls on Friday?
Okay, so they're all actually working remotely. So they were in their homes and not in one room together. And as we said, we currently have 10 people answering phones. That's what we had on Friday as well.
From Jeff with WATE, can you walk us through how the waitlist option system might work?
You know, I want to wait until we have all that finalized and we know more about the details of what that's going to look like and have the contract in place.
From Cole with WBIR, when you have more appointments available in the future, what kind of information do people need to have ready on hand to sign up for an appointment?
We ask for basic information, name. I think we might have asked for address. We'll be asking for address, phone numbers, ways to get a hold of people so we can get back in touch with them if we need to. Basic information that you have to provide for any appointment.
From Jeff with WATE, how important is it to know the specific viral load of someone with COVID-19 instead of just a positive or negative test?
So, you know, COVID-19 is still a new disease, and we're still learning about COVID-19 and what viral loads mean and what they don't mean for COVID-19. So early on in your infection, you might have a low viral load and it goes up and you become more ill. It might be that late in your disease, or later after you've had it, your viral load is going to go down. So at either end, you could have a low viral load. Our testing system is based on positive or negative. It's not based on viral load. That's a different mechanism, a different testing system. That system is not in place. We don't have the data yet to have a system like that for COVID. So right now, our testing system says you have COVID or you don't have COVID. And that's the way the emergency use authorization is written. And that's the way those tests are meant to be used. And that's how it's done across the country and actually around the world.
From Vincent with Knox News, you mentioned that the postponement last night was an opportunity to refocus. What would you like to see the county commission do to support you, public health, and economic recovery?
You know, economic recovery is kind of not my thing, but I'm not even sure what county commission could do, but certainly something I know they would love to focus on positively helping our community move forward, because they're all in the positions they're in because they care about our community. And so I know they would like to do that. You know, to support us, I want them to be, and I've said this before, be actively practicing and supporting the 5 core actions and supporting the actions of the Board of Health.
From Cole with WBIR, there has been some discussion of new recommendations to wear 2 masks, doubling up on masks to better protect against the virus and virus variants. What does KCHD think of this? Should people in our area be wearing 2 masks at once?
So the CDC has not changed their guidance yet. I know there's been some chatter about that, but the CDC hasn't changed their guidance. They still say that a single mask is adequate. A mask is a barrier. And if you're concerned and you feel comfortable and you want to wear more than 1 mask, that's certainly a personal choice. The CDC does recommend that your mask be a multi-layer mask and not just those single. I've seen some of those single fabric masks. Those are not recommended for use in reducing disease.
From Cole with WBIR, do you think the low numbers of new cases we've seen recently is a result of the lower testing numbers? Do you think that means not enough people are getting tested to give an accurate snapshot of our local disease spread?
So certainly we do have some concerns about testing volume, and we'd like to see more people getting tested. But if we look at our hospitalizations and the trending down of hospitalizations, that's really encouraging, because you go to the hospital because you get sick enough to go to the hospital, and getting tested is kind of a choice. Going to the hospital is not really a choice. People go. And so it's not just surveillance. It's really true disease. And we know that. So we're seeing that go down. That's encouraging. Saying all that, we need to watch and wait. And please do not hear me saying we're good. Stop practicing the 5 core actions. Now more than ever is time to practice the 5 core actions. We want to see these numbers continue to go down. We all have to practice the 5 core actions every day, all the time.
From David with WVLT, any update on if the new strains of the virus have been found in Knox County?
So Tennessee is participating with the CDC on looking at the genotyping of virus. So some of the viruses that are collected in the state, not all of them. And so, that's random. And to my knowledge, we haven't seen that. It won't be surprising that we will see it probably. It's what viruses do, they change, and that's not uncommon.
From Cole with WBIR, he says this is a follow-up from his earlier question. What was it like for the phone bank folks on Friday as so many calls were coming in? He says if you'll permit him an old-time TV reference, he imagines it must have felt a little bit like Lucy and Ethel in the Chocolate Factory.
That was so good.
That's probably a really good analogy. Probably felt that way. But what I will say about our phone bank is that they were patient, professional, and kind, and took each caller as they came. It was hectic. I'm not going to say it wasn't. That would be untrue. I haven't actually talked to any of them, but I know they prepped and planned for it. We anticipated that would happen, and they managed it very well.
From Claire with WUOT, most counties have vaccine wait lists managed by the Tennessee Department of Health through Sign Up Genius. Will KCHD's wait list use the same platform, and why hasn't KCHD launched a public wait list yet?
So our platform will be different than Sign Up Genius. And the Sign Up Genius that was launched by the state of Tennessee was launched just for the 89 counties that are not metro counties. So they launched that for those counties to support them. We have used Sign Up Genius a little bit. It's not as robust as what we will be using. So I'm hopeful that what we'll have will serve not just scheduling, but waitlisting and other functions, and also serve as a way for us to streamline even more in the clinic as you move through. So we took our time, worked with county IT, and tried to pick a product that we think would meet the needs that we have and the desires of our staff and the needs of our community. And that doesn't happen overnight.
From Cole with WBIR, how many total doses of vaccine have been received so far, and what's the breakdown of first versus second doses?
I do not have that number in my head, so we can let you know what that number is, because I just don't have it in my head.
Yeah, and we have been reporting those on Thursdays, Cole, during our briefing, so we will continue to do that as well. We'll have updated numbers there, and we're kind of retooling how we present that on our website as well. So once we have that finalized, it'll be online. From Jeff with WATE, follow up on the viral load question. Would knowing a patient's viral load help doctors or help with treatment?
That's a great question for the treating physician. As we've said before, we don't treat COVID, so that's a great question for a provider who's treating patients.
David with WVLT has a question about doses posted on the website, and I believe we just answered that, but that's something that we are restructuring and we'll have up on our website this week. From Claire with WVOT, can you tell us the name of the product or company that will be used for the wait list?
I'm going to wait on details for that until we have a contract in place.
All right, any further questions, please go ahead and submit them. From Cole with WBIR, when would KCHD consider expanding into 70 and older? Do you know how many people are in that 70 to 75 range?
Okay, so what we know, 75 and older, we have about 31,000 people in Knox County who are 75 or older. Obviously, some of those will be covered by the pharmacy relationship with the long-term care facilities. But we want to demonstrate and we want to feel comfortable that we've been able to offer opportunities for the 75 and older group to get vaccinated and to have vaccinated an adequate number of those folks before we expand our age groups. So we are continuing to look at our vaccination rates, and also one way we'll be able to see that is we're opening up for 75 and older. Right now, they fill up like that. And when we see that demand going down, we'll know it's time to open up to the 70 and olders. And I don't know the number of people in that bracket, 75 to 70. So, okay, but I just don't know it.
Any other questions? Please go ahead and submit them now. From Jeff with WATE, the state pushed 65-year-olds back to March. What's the impact locally of that? Do we know how many patients that might affect?
This is Charity. There's approximately 70,000, I believe, people in Knox County, according to census estimates, that are over 65 compared to a little over 30,000 over 75. The number I don't have is what the 70-year-old is in my head, but that shows you the large jump there between 65 and 75-year-olds.
Right, and the data supports vaccinating those older age groups. That's where we see more complications, more hospitalizations, and honestly more deaths from COVID. And again, we want to make sure we have covered all of the 75 and older people that want to get vaccinated with the vaccine. They'll still be able to get vaccinated if they didn't make it to a clinic. Once we open it up, they'll still be able to come because they're also over 70.
All right, any further questions? Please go ahead and submit them now. Vincent says 1 second, I believe he's typing. All right, in the meantime, if anyone else has any questions, Claire with WUOT says, how do you feel about the county commission's decision to push the ordinance taking power away from the Board of Health to April, which I believe you touched on in a previous question?
Sure, yeah, and I know people are curious about that. Again, I think it helps me and helps the Board of Health be able to focus on addressing the pandemic, and especially for us here at Knox County Health Department, getting people vaccinated. And I hope it'll help the County Commission focus on helping our community recover. So we'll just have to wait and see how that rolls out.
All right. Any other questions? Still waiting on Vincent. I believe he's still typing his question out. So in the meantime, if there are any other questions, please go ahead and submit them.
Must be a doozy.
Vincent with Knox News says there's been a few reports from the United States and other places about deaths following COVID-19 vaccination among elderly people. In a mass vaccination campaign, should we expect that people might die after vaccination for unrelated reasons, particularly in vulnerable populations?
Well, so, what you're speaking to is baseline. There's a baseline of people that die from unrelated things, unrelated to vaccine, unrelated to COVID, that die because of heart disease, or they have a stroke, or some other event happens, infection. So there's a baseline of people that die, and sometimes people get a vaccine and totally unrelated to the vaccine, they pass away from something else, and that can happen. So it's not caused by the vaccine necessarily. And there's also a reporting system called the Vaccine Adverse Event Reporting System that we're required to put information in there. And then that's investigated to see if it was related to vaccine.
All right, it looks like that's it from everybody. So thank you all for your time. We hope you have a great and safe day, and that you too also get to enjoy the beautiful weather outside. And we'll see you again on Thursday.